Hi, this is Christy Ducey, and I'm a nursing student with Indiana State University. Today, I want to talk to you about preventing sexually transmitted diseases. But first, please take the link below and take the little quiz, 10-question quiz, and then come back for the rest of the presentation. All right, so what is an STD, or a sexually transmitted disease? There are many different kinds: chlamydia, gonorrhea, syphilis is back, herpes 1 and 2, HIV, and HPV, of course, which causes cervical cancer. Don't think this applies to you? Well, listen up. The CDC estimates that there are about 20 million new cases in the United States each year. Chlamydia is a very common sexually transmitted disease. It can easily be cured, but if it's left untreated, it can make it difficult for a woman to get pregnant. Women usually have symptoms of abnormal vaginal discharge and a burning sensation when they urinate. Symptoms in men could include a discharge from their penis or a burning sensation when they urinate. They may have pain or swelling in one or both of the testicles as well, although that's less common. Gonorrhea, quite common as well. It can infect both men and women. It can cause infections in the genitals, the rectum, and the throat. And it's primarily found in young people ages 15 to 24. Some men with gonorrhea don't have any symptoms at all. However, if they do have symptoms, it's usually a burning sensation when they urinate, an odd discharge from the penis, could be white, yellow, or green, and again, painful or swollen testicles, although, again, that is less common. Most women that have gonorrhea do not have any symptoms, but if they have symptoms, it'd be painful or burning urination, an increased vaginal discharge, vaginal bleeding between periods, and if it's in the rectal infection in men or women, there's usually a discharge, itching around the anus, soreness, bleeding, or painful bowel movements. Trichomonas, trick. It's very common, and it's an infection with a parasite. Most people who have the parasite can't tell they're infected, but about 70% of infected people, they don't have any signs or symptoms. Some people with symptoms get them within 5 to 28 days after being infected. But you would notice an itching or irritation around the genitals, discomfort with urination or ejaculation if you're a male, and have a discharge from the penis, or a change in the vaginal discharge. It could be clear, white, yellowish, or greenish, but the telltale sign in women is a fishy odor, and you can really tell that if you're in a public bathroom. Us women, we can smell it. Genital herpes, it is common as well. Any sexually active person can get it. HSV1 is usually around the mouth, and we usually get that when we're a kid from our grandparents kissing us or whatever. HSV2 is found in the genitals, although they can be found either or place. Since oral sex is quite popular, you could transfer HSV1 to the genitals, and vice versa. They are painful, itchy, small sores that appear. They crack and they bleed, and the virus lives dormant in your body. It can never go away. Although infection, typically the first ones are pretty severe. You may have, and frequent, but that may diminish over time, and you could go a lifetime without having another outbreak. Or you could be an unlucky one that has frequent outbreaks, ongoing. HPV, it is a common sexually transmitted infection. That's why we try to vaccinate young men and women at an early age, not because they're having sex when they're younger, but because they become infected when they do become sexually active. And it can cause various types of cancers, particularly cervical cancer in women. It may not cause any problems immediately, but it could cause also genital warts. And those appear as flat lesions or small cauliflower-like bumps. In women, the genital warts appear mostly on the vulva, but they can also occur near the anus, on the cervix, or in the vagina. In men, genital warts appear on the penis and scrotum or around the anus. They rarely cause discomfort, although if you have an open lesion on your penis, it could be very tender and itchy. And syphilis. Syphilis is back, baby, and you really don't want it. Syphilis is actually divided into stages. There's primary, secondary, latent, and tertiary stages, with the different signs and symptoms associated with each stage. Primary syphilis, a person generally has a sore or sores at the site of the infection. Secondary syphilis includes a skin rash, swollen lymph nodes, and a fever. During the latent stage, there usually aren't any signs or symptoms. And then tertiary syphilis is more severe medical problems. Not everybody gets tertiary syphilis, but if you do get tertiary syphilis, it is neurosyphilis or ocular, and it can affect the brain and your eyesight, your nervous system. Here's a great diagram with the stages of syphilis, so showing the primary with the lesions and then or sores, and then the secondary, you develop a rash, and you can see some early stages of symptomatic neurosyphilis. And then the latent stages where there really isn't any noticeable issues. And then tertiary, where it can really get into your central nervous system and affect your sight and your brain. HIV, or human immunodeficiency virus, is a virus that attacks the body's immune system. If HIV is not treated, it leads to acquired immunodeficiency syndrome, or AIDS. It affects its main symptoms. You'd have fever with weight loss, malaise, headache, neuropathy, swollen lymph nodes, rashes, mouth sores, thrush, sores in your esophagus, sore muscles, and enlargement of your liver and spleen, possibly. How are different STDs diagnosed? Well, generally, they're diagnosed through a blood test or a swab at the site that we're checking. So either vaginal or penile or throat, do a culture. And lastly, anyone who is sexually active can get an STD. Sexually transmitted diseases are preventable. Steps you can take to protect yourself and your partner include abstinence, using a condom correctly every time, having fewer sexual partners, practicing mutual monogamy, and getting vaccinated against HPV. If you do get an STD, it is not the end. Getting tested routinely to check for STDs is important since they're all treatable, although not all are curable. But getting treatment for an STD can prevent the spread. For more information on STD prevention, please check out the CDC's website at thecdc.gov/STD/prevention. Thank you.